Since 2010, with social media and with Instagram, we've seen skyrocketing rates of eating disorders, self-harm, and suicide among our young girls. In fact, Utah has double the rates of most states in terms of suicide for young girls.
What we find is that eating disorders are probably some of the most severe and also some of the most long-lasting of any psychological issue.
But we've also seen a reluctance of people to seek care. Eating disorders have the second highest mortality rate of any psychiatric illness. So opioid deaths are number one, eating disorder deaths are number two. So when people have an eating disorder, we need to be actively treating it. At the Center for Change, we take patients from all over the country. So we currently have 66 inpatient RTC beds, and we're actually expanding and plan to open 36 more beds by the end of the year. We have all levels of care in one campus. So if you need acute or inpatient level of care, we can accommodate that need. And then we also have a residential unit. In the residential, we have adults and adolescents. We have a fully accredited high school on site. So students don't fall behind if they need to come in to treatment. They can go to school 5 days a week with teachers that practice in our communities. Next level of care we have on our Orem campus is day patient, or PHP. So those are great for sometimes moms with young kids that want to be in treatment during the day but still want to go home at night and take care of their family. And then we have what's called intensive outpatient care, or IOP. That's for patients that want to come 3 days a week, 3 hours a day. And then we have just outpatient services as well. We've been here 30 years. We're actually the second oldest eating disorder program in the country now. Over the 30 years, we're almost to 40,000 patients in our inpatient care. And then in outpatient, we treat usually 10,000 patients a year. Most of the Center for Change staff work here for a reason, and it's because they care. And they've either struggled with an eating disorder themselves or a family member has. So when patients come here, I think they'll feel that the minute they walk in the door, that we truly believe we can help them and we want to give them the care they need.